right, the last Wednesday of the month. This is Men's Health Month, and this is a tough topic. It's called suicide. Did you know that women have twice the rate of depression or anxiety, but it's men that commit suicide twice as much as women do. And one theory is, and this is something, men have more lethal means to commit suicide. Our hope is you watch this, and if you find yourself sinking, get the help that you need.
Men are a lot less likely than women to seek help for psychiatric problems, and that probably has to do with their notions of what it is to be manly and to be independent and not admit weakness. The most dangerous times for suicide in the life of men is about between age 45 and 65, and then again at age 85 and up. So the kinds of men that are at the highest risk for suicide tend to be older men with medical problems, men who are divorced, unemployed, and have substance abuse problems are some of the biggest risk factors. And many of these things all seem to come together in older age. People have suffered more losses, they have more health problems.
If you think someone you know and love may be contemplating suicide, there are a few key things to look out for.
They may become withdrawn, detached from their friends and family and their usual activities. They may become more irritable. You may see an increase in the use of substances like alcohol and other drugs. Sometimes very serious warning signs is that they seem to be preparing for death. A healthy person may suddenly become preoccupied with making a will, or somebody may begin giving away their possessions, or they may be talking a lot about death or researching methods of suicide on the internet.
If these things are occurring, Dr. Rosenblatt said, don't be afraid to ask the person if they are suicidal.
It's not true that asking them is going to make them do it or that nobody will ever tell you the truth. And so you should open a dialogue with that person and find out if they're having those kinds of thoughts and then strongly encourage them to seek help.
And after that first step?
There's a lot that can be done for someone who's suicidal. I've taken care of thousands of suicidal people in the course of my career, and almost all of them stop being suicidal when they've had an intervention and are glad that they didn't kill themselves, and they feel more hopeful and able to move on with their life. But treatment is the starting point there, and that may include therapy, it may include medication, it may even include hospitalization if the situation is very severe, but we almost always have a good outcome.